During the meetings with members of the BC Urban Mayor's Council last year, our government heard about some of the safety challenges, the public safety challenges that are facing us across our province. And we asked them for data to help us address those challenges together. The expert recommendations confirm that these evolving crime trends that I've mentioned are very complex challenges. They're compounded, of course, by the pandemic. They are tied to recent changes in federal criminal legislation, as well as decisions from the Supreme Court of Canada that bind, of course, both the Crown and the police. And they highlight the very real need to continue investing in social and health supports that our government has been rebuilding after a decade and a half of cuts.
Currently, my ministry funds 17 situation tables across BC. These are community-based teams that bring together frontline staff from the public safety, health, and social service sectors. They work together to identify vulnerable individuals who may commit criminal offenses or experience harm, and rapidly connect them to the services they need. And we have new services rolling out now that are aligned with the recommendations and that the report tells us will make a difference on the ground. New civilian-led peer-assisted care teams launching in Victoria and New Westminster this fall, and an expanded team on the North Shore. Complex care house opening across the province, providing a higher level of care for people who need it, including those with acquired brain injuries. 2 new Indigenous Justice Centres, and an announcement next week about improving care and transition supports for people who've been incarcerated. The recommendations show how much more work, though, we have to do. We've identified 3 specific recommendations that we want to start on right away. A return of the prolific offenders management pilots that were cut by the previous government. A dedicated provincial committee structure to coordinate service planning for people with complex health needs who come into conflict with the law. And the BC First Nations Justice Council's proposed pilot program based at the Prince George Indigenous Justice Centre to address recidivism amongst First Nations people.
As the 13 mayors, representing 55% of British Columbians, we hear, know, and share our residents' frustrations. From repeat property offenders, and in some of our communities, the unprovoked random attacks, these crimes have a deteriorating impact on our residents' sense of safety and their confidence in the justice system. We are keen to see the implementation of both today's actions and of the continued recommendations, including civilian-led mental health response teams, and the boldly proposed new secure therapeutic facilities that can provide a no wrong off-ramp path of support, care, and treatment for those whose criminal activity is a symptom of severe mental health and substance use conditions.
For either minister, and Minister Rankin, you just made a mention to people feeling safe in their own communities. How is the province going to measure whether people feel safer due to these changes? And how quickly do you expect that these changes will start changing that sense of safety in our downtown course?
I think on a number of fronts. One, the recognition by the public that the province and local governments are taking this issue very seriously and have come forward with this report with a number of recommendations based on the work of experts in terms of things that can be done and implemented. Second is ensuring that we are following through on the recommendations. That's why we've made the announcements that we have today on the 3 areas that we want to move on immediately. And finally, is by things working, by people feeling safer in their neighborhoods, by seeing a reduction in the kinds of random attacks that we have seen, by seeing a reduction in the situations where we've seen the break-ins into businesses, and by the crime stats going down, by police being out there and doing what they've already been doing, which is enforcement. By the system working the way that it should, and the efforts being undertaken in a collaborative way to address this issue.
For Mayor Basran, I know this has become a prevailing issue in municipal elections across the province in the big urban areas. No doubt, I haven't been to Kelowna yet, but I'm guessing you're having to defend your record on public safety in your community. I know it's happening in Vancouver, in Surrey, in Victoria, and other places. Do you believe that the changes today will allow for municipal governments to make the argument to their electorate that things are going to get safer?
Yeah, thanks for the question. I certainly do, because a lot of actually the majority of the things that we as municipalities have been calling for or asking for are in these recommendations. And back maybe to your earlier question, through things like point-in-time counts, for example, in Kelowna, there are 15 individuals in our city responsible for over 1,000 touches with police last year. Our RCMP officers know who these individuals are. So how do we track this, or how do we know that improvements are being made? Because we can track the outcomes of those 15 individuals, and through various things like complex care, getting people into homes and getting the supports that they need. We know who these people are. We know their names. We have the data. So it's going to be very easy, I think, to be able to report out and see where we're making progress and see where we're not, and to continue to advocate for change. But again, this comes down to collaboration. And I think what's really important about today from the BC Urban Mayors Caucus standpoint is it's very hard for us mayors to tell a business owner who's had their business broken into time and time again to say, well, it's out of our hands. All we can do is enforce through policing, but mental health, addictions, housing don't fall under our jurisdiction. Our residents don't care whose jurisdiction it is. They just want to see action. And that's why today is so important, is because collaboratively, we now have a path forward. There are implementation recommendations being implemented today, and I can guarantee that the BC Urban Mayors Caucus will continue to work with our provincial government and advocate with our federal government on making sure the rest of those recommendations are followed through. Yes, I know that some of them are long-term, but at the end of the day, we are finally on the right path. And so I am happy going home to be able to explain to our residents that we are being taken seriously, and there are measures that are going to have the outcomes that we're hoping for.